Our first transplant patient was transplanted in 1985. We still, believe it or not, have some patients who are alive from that first year. So 23 years after a heart transplant, relatively, alive and relatively well from their surgery. Right now, one of the more exciting advances in heart transplant is trying to predict when patients are having rejection without having to do invasive procedures. So right now, we have to do a heart biopsy. We actually have to put a catheter in the heart and snip off a little piece of heart tissue to look for rejection. And there are some blood tests now that can actually tell us if the patient's more likely to have rejection than not, and then kind of maybe decide which patients need a biopsy and which don't. So that's one of the newer developments in the transplant field. The heart failure population, many of these people are very sick when we meet them and end up taking care of them. And to see some of these patients, I see them frequently because the heart failure is a very sort of labor-intensive thing to treat. So I get to know the patient, I get to know their families, and for some of these patients that are very, very ill, to then transplant them and see them a year later at our golf tournament or doing things that they just thought they'd never do again, and interacting with the patient and their family, I think that's what's most rewarding for me.